Hello, legislators. We are graduate nursing students from University of Concordia, Wisconsin, and we are here to encourage you to vote yes in the upcoming session for Wisconsin Assembly Bill 924. This bill will remove the personal exemption as a reason for not vaccinating our public school children. By removing that personal exemption, we can save money on the state healthcare budget by preventing disease and also save lives of our constituents. And we can gain support of major health organizations who approve this bill. So remember, vote yes for Assembly Bill 924. Assembly Bill 924 is an act to amend Statute 252.04 Part 3 relating to eliminating personal conviction exemption from immunizations. If this bill passes, the exemptions for medical reasons and religious reasons will still be in place, but the bill eliminates the ability to waive immunization requirement for schools, child care centers, and nursery schools for the reason of personal conviction. This bill was introduced by Representatives Hintz, Berceau, Call, Pope, Sinicki, and Subek on February 18, 2016. It was co-sponsored by Senator Risser. The latest major action on this bill was April 3, 2016, when it failed to pass pursuant to Senate Joint Resolution 1. The bill is currently in the Health Committee. After speaking with the office of Gordon Hintz, he fully plans to reintroduce it next session for your consideration.
The CDC requires each state to keep track of immunization compliance, and Wisconsin, like most states, keeps track through annual school enrollment. In 2016, 0.4% of students had medical exemption, 0.2% religious exemption, and 4 to 4.7% personal exemption. Wisconsin's personal exemption rate more than doubles that of the national average, and when there are lower rates of compliance, herd immunity may be compromised. Herd immunity is the benefit of having at least 92 to 95% of a population immunized. It protects those who cannot participate in immunization or at high risk of mortality. These include individuals who are breastfeeding, pregnant, infants, immunocompromised, or elderly. An individual who chooses not to be immunized is at significantly high risk of contracting disease. In 2016, Wisconsin met this goal by having 92.5 to 96.9% immunized, however, potentially could be at the cusp of losing this benefit. Mississippi faced similar challenges in the past, and in 2007 implemented a policy only allowing medical exemption. Since then, they jumped from 18th to first place in immunization compliance with a rate of 99.4%. California is facing similar issues with compliance and has followed Mississippi's footsteps in eliminating personal as well as religious exemption. An outbreak that was made very public in 2015 was at Disneyland in California, where a single individual traveled overseas, contracted the measles, and then infected 133 other people. 57 of these people made a choice not to immunize themselves.
The current statute regarding immunizations allows exemption for medical, religious, and personal reasons. Assembly Bill 924 proposes to remove the personal exemption and leave medical and religious exemptions in place. The intent of this bill is to increase immunization compliance among Wisconsin public school children, and thereby decrease risk for acquiring preventable diseases. As Jessica described in the previous slide, higher compliance means a better chance of herd immunity for the school children of our state. The goal would be 100% compliance, and this bill is a good step in that direction.
In passing of Assembly Bill 924, a potential unintended consequence may be parents choosing to remove their children from public or private schools, nurseries, or daycares and transition their children to homeschooling. There are no reports regarding the immunization compliance of homeschooled children. These children being removed from the data may provide artificially high immunization compliance rates when in fact they may not be. Parents may also attempt other routes of attaining exemptions such as medical or religious. However, Wisconsin does have specific guidelines regarding criteria an individual must meet to attain these. Since the implementation of the Affordable Care Act in 2010, the out-of-pocket of expense for immunizations has been removed for those with private insurance. For those with Medicaid, Badger Care, or no insurance at all, these are programs available to cover immunizations such as the Vaccine for Children program and other programs. Assembly Bill 924 creates no out-of-pocket expense for Wisconsinites and no increased costs to the state. Nationally, immunizations prevent 42,000 early deaths and 20 million cases of disease, with a net savings of $13.5 billion in direct costs and $68.8 billion in total societal costs. If we imagine that each state equally is affected by the previous data, Wisconsin prevents 840 deaths, 400,000 cases of disease, $27 million in direct costs, and $1.4 billion in societal costs are saved because of immunizations.
Immunization is a hot topic in today's political climate, especially with all of the recent outbreaks of preventable diseases in the nation. While many groups have a stance on the topic of this bill, here are some well-known local organizations who have spoken up about immunization exemptions. The Wisconsin Medical Society opposes personal exemptions for immunizations. The Wisconsin chapter of the American Academy of Pediatrics stated in 2014 that the only acceptable exemption from immunization is medical. Northeast Wisconsin Immunization Coalition has a goal stated on their website of 100% immunization compliance for Wisconsin. Wisconsin for Vaccine Choice said in 2016 that they oppose vaccine mandation of any kind, whether that be medical, personal, or religious.
As graduate nursing students, active registered nurses, and fellow Wisconsinites, we hope that the brief of Assembly Bill 924 has moved you to support it in the upcoming legislative year. Removing personal exemption as an option for immunizations will have the biggest impact on rates of immunization and allow for Wisconsin to not only improve those rates, but continue to preserve its herd immunity. Immunizations are already covered, whether through private insurance or public programs, at no cost to the state of Wisconsin. Success of this bill will be evaluated in the following years as schools annually report immunization compliance of its students.